Right now in your bathroom cabinet or your kitchen drawer, there's a small bottle that your doctor said was perfectly safe. And there's a real chance it is quietly pulling your memory down, one day at a time, not your age, not just getting older. A pill so common that millions of people take it every single night without a second thought. I have sat across from patients who were sharp their entire lives, people who ran businesses, raised families, never missed a birthday or a bill. And then, slowly, they start forgetting where they parked, forgetting a grandchild's name for just a second, forgetting the end of a sentence they were just saying. And everyone around them, including their own doctor sometimes, says the same thing. That's just aging. I want to tell you something important right at the start of this video. Sometimes that is not aging at all. Sometimes it is a medication, sitting quietly in a pill box, doing damage nobody warned them about. I'm Dr. Michael Lin, and welcome back to Dr. Michael Lin Senior Health. I want to tell you about a patient I'll call Carol, because her story has stayed with me for years. Carol was 68, sharp as anyone I knew, ran her own bookkeeping business well into her 60s. Over about a year, her daughter noticed small things. Carol repeating herself in conversation, forgetting where she put her car keys, sometimes twice in one afternoon. Her family doctor mentioned the word dementia gently, almost as a formality. Carol was terrified. Her daughter was terrified. What nobody had asked in 3 separate appointments was what Carol was actually taking every night: a nightly allergy pill for her sinuses, a bladder medication she'd been on for 6 years, and a sleep aid she picked up herself at the pharmacy because she didn't want to bother her doctor about something as small as trouble sleeping. When we finally sat down and reviewed everything together, line by line, the picture became much clearer. Within 4 months of carefully adjusting those medications under her doctor's supervision, Carol's daughter told me her mother was back, telling stories at dinner, remembering names, laughing the way she used to. That is not a guarantee for every single person. And I want to be honest with you about that, but it is exactly why I made this video today. Today, we are going through 9 common medications that researchers have linked to a much higher risk of memory loss and dementia in people over 60. I'm going to walk you through each one, explain exactly why it affects your brain, and more importantly, what safer options you may want to bring up with your own doctor. Please do not stop any medication on your own after watching this. That is never the message here. The message is knowledge, because once you understand what is happening inside your brain, you can have a much smarter conversation with the person who prescribes your medications. Before we get into the list, I want you to do one thing for me. In the comments below, tell me your age and tell me how many medications you currently take every day, including the over-the-counter ones. I read every single comment. Now let's get into it, because some of what's coming up surprised even me when I first read the research. Let's start with number 9, and don't let the low number fool you, because this medication is sitting in almost every home in America right now. Number 9 is diphenhydramine. You probably know it by its store name, Benadryl. It's the little pink pill people take for allergies, for a stuffy nose, or simply to fall asleep at night. It's cheap, sold right on the open shelf next to the vitamins. And because you don't need a prescription for it, most people assume it must be gentle on the body. Here's what is actually happening inside your brain. Benadryl belongs to a family of drugs called anticholinergics. That's a long word, but the idea is simple. These drugs block a brain chemical called acetylcholine. Think of acetylcholine as your brain's messenger system. It's what allows your brain to form a new memory and file it away properly. The same way a librarian places a book on the correct shelf so you can find it later. As we get older, our brain naturally produces less of this chemical. So when a drug blocks even more of it, the effect lands much harder on a 65 or 70-year-old brain than it would on someone in their 30s. The part of your brain that takes the biggest hit is called the hippocampus, a small curved structure shaped a little like a seahorse, where Our new memories are formed before they get stored for the long term. I have had patients who took a nightly allergy pill for years, slowly losing their sharpness, and never once connected the fog to that little pink pill on their nightstand. A study published in the Journal of Geriatric Cognitive Health followed older adults who used anticholinergic medications regularly and found a 54% higher risk of developing dementia compared to people who avoided these drugs. That is more than half, again, the normal risk, from something many of us treat like candy. So here is what I want you to do. Go check the label on anything you take to help you sleep, and anything labeled PM, nighttime, or allergy relief. Many of these are simply Benadryl wearing a different name on the box. If you need something for allergies, ask your doctor about loratadine, sold as Claritin, which does not cross into the brain the same way and is considered much gentler for long-term use. Never stop a medication suddenly on your own. Bring this information to your doctor and let them guide the next step. Number 8 is one your stomach may love, but your brain may quietly be paying the price for. These are proton pump inhibitors, often called PPAs. The most familiar names are omeprazole, sold as Prilosec, and esomeprazole, sold as Nexium. These shut down acid production in your stomach and are commonly prescribed for heartburn and acid reflux. People often stay on them for years, sometimes decades, because the moment they try to stop, the burning comes right back. Here's the part almost nobody explains at the pharmacy counter. Your stomach needs acid to properly absorb certain nutrients, and one of the most important is vitamin B12, essential for protecting the wiring of your nerves and brain. When you turn down stomach acid for a long period, your B12 levels can quietly drop. So can magnesium and calcium, two minerals your brain cells depend on to communicate properly. When those levels fall low enough, you can experience confusion and memory slips that look a lot like early Alzheimer's, when the real cause may simply be a nutrient deficiency caused by the medication itself. A large study published in JAMA Neurology looked at more than 73,000 adults aged 75 and older. Regular PPI users had a 44% higher risk of developing dementia. Researchers have also found that long-term PPI use may raise levels of a sticky protein called amyloid beta in the brain, the same protein associated with Alzheimer's disease. If you take a PPI every single day, that's worth discussing with your doctor. Many people are able to switch to a gentler class called H2 blockers, such as famotidine, sold as Pepcid. The goal should always be the lowest dose for the shortest time that still controls your symptoms, not a habit you fall into for 20 years without ever questioning it. Number 7 is prescribed for something most people would rather not bring up at the dinner table. This is oxybutynin, sold under the name Ditropan. It's given to seniors dealing with an overactive bladder, that sudden, urgent need to find a bathroom that can completely reshape someone's day and confidence. I understand how real that relief feels, but oxybutynin works by blocking acetylcholine, the very same memory chemical that Benadryl blocks, and this particular drug crosses into the brain very easily. A study published in the British Medical Journal followed adults over 65 who took strong anticholinergic medications like oxybutynin for more than a year. Their risk of developing dementia was 49% higher, nearly 1 in 2. What troubles me most is that almost none of these patients were ever warned. They were simply told a pill would calm their bladder. Nobody mentioned it might also be dimming their memory at the same time. If you take oxybutynin and you've noticed your memory slipping lately, please take that seriously, because you should never have to choose between your bladder and your brain. Newer medications, such as mirabegron, sold as Myrbetriq, work through a completely different pathway and don't block acetylcholine at all. It's absolutely worth bringing up at your next appointment. Number 6 might surprise you, because it's one of the most commonly prescribed medications on the entire planet. This is the statin family, including simvastatin and atorvastatin, sold as Zocor and Lipitor. These do important work lowering cholesterol and reducing the risk of heart attack and stroke. I want to be very clear, this is not an argument against statins. They save lives every single day. But there is a part of the story that often gets left out. Your brain is almost 60% fat, and it relies on cholesterol to build the myelin sheath, the insulation wrapped around your nerves, so signals can travel quickly and clearly. Think of it like the rubber coating around an electrical wire. Strip too much away, and the signal starts to weaken or flicker. When cholesterol is lowered aggressively, some research suggests the brain can be left short of a material it actually needs. A study published in Frontiers in Aging Neuroscience found that adults over 70 who had been taking statins for more than 3 years had a 26% higher rate of mild cognitive impairment, stronger at higher doses. Some patients describe forgetting a familiar name, losing track of a conversation they just had, or suddenly feeling lost on a route they've driven for 20 years. Not every statin behaves the same way. Pravastatin and rosuvastatin do not cross into brain tissue as easily and are generally considered gentler choices. If you've been on a statin for years and noticing fog, that's a real conversation to have with your doctor about its adjustment, never a reason to stop a heart medication on your own. But wait, the next one on this list is something almost everyone over 60 has either taken themselves or watched a parent take, and what the research shows genuinely surprised me when I first read it. Quick favor before we continue. If this video is helping connect some dots for you, take 1 second and tap that like button. It genuinely helps this information reach more seniors who need to hear it. And while you're there, let me know in the comments how many of these 9 medications you recognize from your own pill box. Number 5 is the benzodiazepine family. Lorazepam, sold as Ativan. Diazepam, sold as Valium. Alprazolam, sold as Xanax. These are among the most prescribed medications in the country for anxiety and trouble sleeping. They work by boosting a calming brain chemical called GABA. At first, they can feel like a genuine rescue. The racing thoughts slow down, sleep finally comes. A study published in the British Medical Journal followed more than 8,000 seniors over 6 years and found that those who used benzodiazepines for longer than 3 months had a 51% higher risk of developing Alzheimer's disease. Longer-acting versions, like diazepam, appeared even more concerning because they build up in fatty tissue, including the brain. I think of it a bit like turning down the volume on every part of the brain at once, not just the part that's overactive. You wanted to quiet the anxious thoughts, but you end up quieting your memory and alertness right along with it. Here is something critically important. If you have been taking a benzodiazepine for more than a few weeks, never stop it suddenly because that can actually be dangerous. Work closely with your doctor to taper off gradually. There are gentler alternatives worth discussing, such as buspirone and certain forms of talk therapy designed specifically for sleep and anxiety. Number 4 is a medication prescribed for 3 completely different problems, which is exactly why so many people end up taking it without realizing what it really is. This is amitriptyline, sold as Elavil. It's an older antidepressant, still widely prescribed for nerve pain, sleep troubles, and migraine prevention. But underneath that flexibility, amitriptyline is one of the most powerful anticholinergic medications still in regular use. A large study published in JAMA Internal Medicine followed more than 3,400 adults aged 65 and older. Those with the highest cumulative exposure to anticholinergic medications like amitriptyline over a 10-year period had a 54% greater risk of developing dementia. It doesn't even require a high dose. A small nightly dose taken for years can quietly affect brain function without any obvious warning sign. If you or someone you love takes amitriptyline, For nerve pain, options like duloxetine or gabapentin may offer similar relief with less impact on memory. For sleep, very low-dose doxepin or melatonin may be gentler. For mood, newer antidepressants like sertraline or escitalopram are generally considered safer for long-term brain health. Number 3 is the one I want you to pay close attention to because it's prescribed to millions of people for something that sounds completely harmless. This is paroxetine, sold as Paxil, one of the most widely prescribed SSRIs, used for depression and anxiety. On the surface, it looks gentle and modern, but paroxetine is the one SSRI with strong anticholinergic activity, setting it apart from sertraline and escitalopram. A large review published in Frontiers in Psychiatry found that paroxetine users showed measurable declines in short-term memory, word recall, and attention within just the first 12 months, 30% more likely to show early signs of cognitive decline than those using other antidepressants. The American Geriatric Society has placed paroxetine on the Beers list, a formal list of medications considered potentially risky for older adults. If you currently take paroxetine, it's worth discussing whether switching to sertraline or escitalopram might be gentler for you. And what I'm about to tell you now, at number 2, surprises almost everyone because most people taking this medication don't even know what category it belongs to. Number 2 is the antipsychotic family, including quetiapine, sold as Seroquel, risperidone, sold as Risperdal, and olanzapine, sold as Zyprexa. These were originally developed for serious psychiatric conditions like schizophrenia and bipolar disorder. Today, they're frequently prescribed off-label to older adults for sleep difficulties, restlessness, or agitation. A study published in Lancet Healthy Longevity followed more than 25,000 older adults and found that those given antipsychotic medications for behavioral symptoms were 71% more likely to experience worsening cognitive decline within a year, even with no prior history of dementia. They work by reducing dopamine, involved not just in mood, but focus, planning, and memory. If you or someone you love is taking one of these medications, ask the prescribing doctor, why was this started and is it still necessary? Many behavioral symptoms can improve through routines, reduced noise, better pain management, and improved sleep, sometimes without medication at all. And now, number 1, this isn't a single medication at all, and it might be the biggest hidden factor behind everything we've discussed today. Number 1 is anticholinergic burden, taking several of these memory-blocking medications all at the same time. The real danger often comes from the slow buildup of multiple medications working together, while nobody ever adds up the total effect. Picture a senior who takes Benadryl every night for sleep, oxybutynin during the day for bladder control, and amitriptyline for nerve pain. Individually, small effects. Together, those effects stack, and the burden on the brain rises quickly. A study published in Age and Aging tracked more than 280,000 older adults and found that those with the highest combined anticholinergic burden had a 120% higher risk of dementia within 10 years, more than double the normal risk. Most had no idea they were even taking medications from this category. Here's the hopeful part, and it's the reason I made this video. Medication-related memory decline is often reversible when caught early. When the burden is reduced under proper medical guidance, many people regain clarity, energy, and sharper memory within weeks or months. The solution doesn't require anything dramatic. Sit down with your doctor or pharmacist and go through every prescription, every over-the-counter product, and every supplement you take. Ask specifically about anticholinergic burden, since many pharmacists can score this for you. Once higher-risk medications are identified, your doctor can work with you to reduce or replace them safely. Now, I'd love to hear from you. Out of these 9 medications, which ones did you recognize in your own medicine cabinet? Tell me in the comments, and consider telling me that you'll bring up a medication review at your next appointment. Your comment might be exactly what helps the next person reading it feel less alone. Remember, this video is for educational and informational purposes only and is not intended to diagnose, treat, cure, or prevent any disease. Please consult your personal doctor or qualified healthcare professional before making any changes to your health routine. If you found this video helpful, don't forget to subscribe to Dr. Michael Lynn's Senior Health and hit the notification bell so you never miss a health tip. I'll see you in the next video.